Hi, this is Julia. Welcome to my OCD diary. And don't mind me, I am kind of relaxing over here today, but I have new pillows and they're comfortable, so this is where I'm going to be. So, I know it can be really scary to get an OCD diagnosis, which is why I'm going to talk about OCD and parenting. Like if you're a parent and you have a child with OCD, this is what I would suggest. So, first of all, knowing what OCD is really important, and this could be where some of the disconnect happens within family dynamics. OCD is an anxiety-based disorder. It stands for Obsessive-compulsive disorder and is characterized by intrusive thoughts and repetitive rituals. Now, not everybody gets the rituals, but everyone with OCD will definitely have the anxiety and the repeating thoughts, feeling like they don't have control over their thoughts. So, for someone else without OCD, they might get an intrusive thought like, oh, like something bad's going to happen to someone I know, and then the thought kind of goes away and they can move on. People with OCD really can't do that. It's almost like a broken record. So for someone else, the thought loop goes around one time, thought's completed, and it's done. But people with OCD, it's like the thought loop goes around, but then it goes around again and again and again. And then they feel this need to, a lot of times, compulse to get rid of the thought. So like for me, what that looked like was I thought something bad might happen to someone I knew if I didn't flip my light switch on and off 20 times, so then I would do it, and then it didn't feel right, so I felt like I had to do another 20 times, and then that didn't feel right, so I had to do another 20 times, and then my OCD anxiety kind of felt better, so then I could stop, and that would go on all the time with a bunch of different things. And I think the question people have that I always got is, well, why can't you just stop? Because the truth is, I knew it was irrational. Like, I hated the fact that I was doing these weird rituals because I knew it didn't make any sense, and I knew that my light switch had no influence on anybody else, but still, I couldn't seem to help it, even though I tried really hard. And that's really true with anyone with OCD, is that they try really hard, but it is out of their control. And it has to do with serotonin and a bunch of other things, but that's kind of like the main thing people are going to talk about when they discuss causation. So it's a biochemistry thing. They don't know exactly if it's too much serotonin or too little serotonin or what's going on, but essentially it's a problem with the neurotransmission in the brain, and which explains why someone with OCD knows it's irrational but still feels like they can't control the thought loop. So that's, I think, really, really important to accept and understand, because there's two things going on here. One, just knowing that your child wants to stop and that it's not a lack of positive thinking or a good attitude or maybe they have low self-esteem or they're too stressed out, or it's nothing like that. And on the other hand, it's not poor parenting either, or I don't know, anything else like that, any other environmental influence. It has more to do with just the fact that that's how their brain is. And it usually triggers a little later in life, like around teenage years or age 20. For a lot of women, it triggers a pregnancy. Like, it just, any crazy event could kind of bring it out sometimes with people. But generally, the person is most likely an anxious person kind of anyway. But again, everyone's different. What your child's probably dealing with is a lot of anxiety, definitely, some depression, maybe isolation, problems at school. There's a whole host of other things that can go with it. And it's definitely not going to be easy, but it's very possible to move through it because there's a lot of treatment options out there. There's acceptance and commitment therapy, cognitive behavioral therapy, lots of psychological stuff that's got really good success rates. There's also antidepressants like SSRIs, and those are more not so much because the child would be depressed, they're more because they affect the serotonin levels in the brain. Those also are they have an okay success rate, but not as good as therapy. Although some studies suggest that between the two of them, the success rate is pretty high. But you know what? I'd never tried SSRIs, so I really can't attest to that. But I can say that therapy helped a lot. I tried a lot of things, a lot of home remedies, and I did find a lot of things didn't work. A lot of things did work. It was definitely a process. But aside from that, there's things you can do as a parent. So the first thing I would say is get educated, on what OCD is, so you can better understand, which will probably help not just them, but it'll help you have more understanding of like why they're doing certain things. That way you may not get quite as frustrated when they're being a little repetitive. Have compassion. Know that they're probably really embarrassed and that they hate it, and it can really bog down their self-esteem. Also be supportive in terms of like if therapy is an option, I would encourage that. And I think lastly, just know that it's not their fault and it's not your fault. So just commit to not quitting, move forward. Know there's going to be good days and bad days, that it can get a lot better. So just don't give up.